Hi, my name is Lucy Dormer. I am an occupational therapist working here at the Bristol Haematology and Oncology Centre. And I have come to do a brief presentation on managing cancer-related fatigue. Firstly, just a quick definition of what occupational therapy is. It's not that well known, but basically within this setting, we try and help people to achieve the things that they want to, which they can be finding a little bit challenging or difficult to do if they're feeling unwell or with a cancer diagnosis or feeling poorly. It can be quite difficult. And it's all those simple things. So climbing the stairs, washing your hair, making a cup of tea, taking your kids to school, all those things can become really challenging. And something that can really impact on that is fatigue. So hopefully this presentation will give you an understanding of what cancer-related fatigue is, but also some tips and ways to try and help manage it. So what are we going to cover? So we're going to cover what is cancer-related fatigue, tips for managing it, and then chat around ways to rest and recharge your battery effectively. So cancer-related fatigue is more common than you would think. It can affect anywhere between 60 and 96% of patients who have a cancer diagnosis. So it's a big thing and it's a big impact on people's lives. So it does need looking at. So what is cancer-related fatigue? It's not just feeling tired. It's not just that feeling of you've had a hard day and you're kind of collapsing into the chair at the end of the evening. It's more than that. It's multifactorial. So it can be physical things, emotional things, and cognitive things, which are causing that cancer-related fatigue. And it can impact on you in many ways. It can make you feel very isolated from those people around you, your loved ones, your relatives, your work colleagues. It's very difficult to explain cancer-related fatigue and how you're feeling, so it makes it quite challenging for the people around you to understand. It can make you feel like you lose yourself a little bit, your role, your routine, your sense of self. So it's really challenging. And it's also one of the major causes of distress in cancer survivors. So it does have a huge impact on people and how they are coping after their cancer diagnosis and after they've finished their treatment. So what's the difference between feeling tired and fatigued? Fatigue is very different from that feeling of being tired or exhausted that people without cancer may experience after a heavy exercise or a busy day at work. Fatigue often involves that sudden loss of energy. So all of a sudden, you'll just feel like you have to collapse. If you don't sit down, then you will fall down. And you just cannot continue with what you were doing. And again, as I said, fatigue can be either physical or mental fatigue. It's not just those physical things that are causing it. And also it can be both of the things at the same time. So a quote that a patient once said to me was, "Fatigue feels like I need to lie down, but I'm already lying down." So when and why does it occur? It can occur at any point. So before diagnosis as a symptom, at and around the time of diagnosis. It might be what led you to your GP. It might be, so you went to them and said, you know what, I'm feeling absolutely exhausted. And that's what kind of started this whole process. It can occur during the active treatment phase. So the kind of side effects of the chemo or the radiotherapy that you're having. But also, and most importantly, probably it can occur after the treatment phase is finished. Unfortunately, it doesn't necessarily stop once the treatment has. It is something that some people will need to continue to manage and continue to try and work through to kind of try and get back to normal if they can. So why does it occur? The lovely umbrella, it's kind of an umbrella of terms. So it can occur because you might have had some surgery and you're recovering from that surgery. Your appetite might not be as good as it was. So you're not getting all those healthy nutrient foods inside you. So you haven't got the energy to use. It can be a side effects of the drugs that you're on, a lack of exercise, the cancer itself. It might be something like anemia, pain, emotional distress, the constant having to talk things through with people, your consultant appointments, all those things can add into it. The chemotherapy, the radiotherapy, anxiety. Anxiety is a hugely fatiguing thing to be experiencing. And when you have a cancer diagnosis, it's so common and you can't kind of get away from it. So it's exhausting for people. And then also poor sleep. Poor sleep can be massive within struggling with fatigue. So all those things are kind of coming at you really, and they're kind of trying to create that fatigue. So the next two slides are quotes from people that took part in the Macmillan Step Up service. And it kind of is a way of trying for people to try and explain what that fatigue was for them. So I will read them out. I was not sleeping properly. I was dragging myself out of bed in the morning, only to collapse into a chair and rest. The slightest effort resulted in complete exhaustion. I was completely withdrawn. I refused all offers to socialise and did not set foot outside the door in the evenings for more than 6 months. So I don't know if that kind of describes how people are feeling. But if that is how you're feeling, that must be a really difficult position to be in and make life really hard. And then the second one, I was angry with myself. I felt worthless and kept breaking down in tears. And this all added to the stress my family were experiencing, which in turn contributed to my depression, while overriding everything was fatigue, fatigue, fatigue. So just can't get away from it. It's just everywhere you go. And it's not just impacting on you, but it's impacting on the people around you. So this is a quote from the Myeloma Association. So fatigue is like having a harness that you put on when you get out of bed in the morning. And then everything that you do that day, you've already got this massive, great big harness on your back. And you're struggling to get all those jobs and tasks done that normally you would do without thinking. But you're already weighed down right from the word go. So how long will it last? So fatigue, as I said before, doesn't necessarily stop, unfortunately, once your treatment has finished. It can be something that will continue to impact on how you're doing your day-to-day tasks, which is why it's really important to try and come up with some strategies and some coping mechanisms of how to deal with it. The most common way to deal with, or from what I hear from what patients say and kind of some experience of doing this before, most people tend to deal with their activities and the way they do things with boom and bust activity cycling. So generally what people tend to do is they will boom. So you have a bit of energy when you wake up in the morning and you rush around like a headless chicken. You try and get as much done as you possibly can and you boom. But then unfortunately you're going to have that bust period. So you'll have that period then afterwards when you feel really fatigued and you just can't possibly do anything else. And then within that as well, you'll feel like you're not doing as much, you've let people down, and you have that kind of psychological impact as well. And then it's kind of a cycle. You might manage to wake up in a couple of days' time and have a bit more energy. So you boom again and you do loads. But again, you'll have that down period. And unfortunately, if you continue to manage things in that way, the bust period will last longer and longer every time. And the boom period will get shorter. So you won't be able to manage to do as much. So this is just another slide, another way of representing that information. And as you can see that the blue line above gets smaller and smaller. And unfortunately, the kind of your energy levels go into the negative, unfortunately. So there's lots of different ways to try and manage your activity levels if you can. It's a conscious thing. It's not like before, unfortunately, where you didn't really have to think about it. You do consciously have to think, what have I got to do today? What have I got to do this week? And how am I going to be able to do it all? And one way that is suggested is to think of your energy levels as a battery. So you wake up in the morning and hopefully you've got 100%. So your battery's green, it's ready to go. And you need to get through the day without using it all up. Because if you do use it all up, then you'll be left at the end of the day with nothing left. And you don't want to get to that point. You want to try and get to the end of the day with a little bit left. And what you need to try and do is think of those things, say, for example, that you've got to get done that day or that week, and try and work out if they're high energy taking activities for you or if they're low energy taking activities for you, and try and balance them out. So you're not trying to get everything done straight away. And always remember that these activities can be physical, mental, or emotional. So it's not just the fact that you need to walk your children to school or you need to clean the house, for example. It can be that you've got an appointment with your consultant and you're really anxious about it, or you need to discuss financial matters with your wife or husband. Those things as well can really drain you of your energy levels. So as occupational therapists, we often talk about the 3 Ps, which are planning, prioritizing, and pacing. And that's just basically, again, of thinking about what you've got to get done, how you can do it, and how you can prioritize the things that you really want to do and the things that you don't necessarily need to do, and trying to pace them throughout the day or through the week, and just trying to plan a little bit more. But as I said, it is a conscious effort. So it's not, you do have to think about it, which is different, I suppose, to normal. So with activity management, you really need to aim for gain without pain. You need to listen to your body. Your body will be telling you when it's time to stop or time to kind of take a rest. And it's best to do a little bit, have a rest, do a bit more. And as I said before, what you'd want to try and do is try and get to the end of the day without feeling completely exhausted. It's really important to communicate with the people around you if you can, and try and do that earlier on. So it's not all just kind of built up into the evening, say, for example, because then it can become quite stressful and intense. So if you are feeling that you're not going to get everything done, try and let the people around you know. And be kind to yourself. It's okay to say, I can't do everything that I used to. That's all right to do, and to be positive about the things that you do get done. And it might be different to what it was before. So it might just be that you've managed to wash your hair or have a bath, but that is a positive thing and that takes up a lot of energy. So kind of be kind to yourself about it. So other ways to try and help you with your energy levels, as the one of our other presentation talks about, getting active. Increasing your activity levels can help release happy hormones, improve your mood, your body image and your self-esteem. Also doing a bit more activity during the day, as long as you're balancing it out with rest, can help you with your sleep at night time. And also it gives you a sense of taking control, which is always really helpful. So do try to allocate some energy that you have in your battery to physical activity. And if you can try and build on that, then that's great. But always remembering to build in the rest periods. So cancer-related fatigue can make getting back to work challenging and difficult, but you are protected within this. So it's really good to know what your rights are and what your employers will offer you. Macmillan can be really helpful with this, so do make sure that you use those resources. Your employers are obliged to consider reasonable adjustments to make your work environment easier for you to be in. And there's no fixed standards, so it's about what's suitable for you and your employer. It doesn't necessarily need to be what worked for somebody else. You can always consider a phased return to work based on what you can do, not what you did do. That's a really important distinction to make sure that your employers understand. You could consider a temporary reduction in your hours, and then also make sure that you're aiming for sustainability. There's no point promising that you're going to be able to do lots of things that you used to do that you're not going to be able to. So make sure it's a realistic thing that you're offering. Occupational health can be really helpful. So if your organisation that you work for has occupational health, make sure that you use them and you're in contact with them. They can be really good. Healthy eating is really important if you're struggling with cancer-related fatigue. What you eat can affect your body and your mood, and it can really help improve your well-being and boost your energy levels. Sleep is something else that can be really impacted on by cancer-related fatigue, and you'd think that sleep would be really easy to achieve. If you're feeling fatigued, you would just go to sleep whenever you can. But unfortunately, it's not, and it's something that people often say that, do you know what, I'm tired all day, I'm exhausted all day, but it gets to nighttime and I just cannot switch off. I think often our minds start whirring and we just can't get out of that. And it's all common sense stuff, and it's probably stuff that everybody knows, but it's always good to just have a little refresh and kind of think to myself, am I doing the right things? So try and establish a good environment for sleep. So cool, dark, try and keep your iPads and your mobile phones away if you can. Try and establish helpful routines, so regular get-up times and wind-down routines. Don't necessarily force yourself to go to bed at the same time every day, because I think if you do that and you're not sleepy, then you're just going to lie there and get cross and agitated. Try and notice the difference within your body of the difference between being sleepy and exhausted, and try and go to bed when you are sleepy. If you try and go when you're exhausted, it doesn't work quite so well. And if there's other things that are impacting on the way that you're being able to switch off and go to sleep, try and deal with them earlier on in the day. So if there's a conversation that you're putting off, try and have it earlier to kind of feel like you've dealt with it, or write it down in a book on the side of your bed or something like that. That can always help. And there's just 2 useful websites there on the slide that it's quite helpful to have a look at. So restorative activity, so rest basically, is really important if you're struggling with fatigue. It's important to be able to try and fit rest into your daily routine. And rest can be different things for different people. And it's not sleeping. So it's not going to sleep in the middle of the afternoon. It's about trying to recharge your batteries. So some things take energy away from your battery and some things fill the battery back up. So if you can build some rest or restorative activity into your day, then that's really helpful. And that can be reading a book, having a bath, being outside in the countryside, listening to music, anything like that. But try and build it into your day, and that'll help recharge your batteries. So there's a really helpful booklet from Macmillan called Coping with Fatigue and Tiredness. It's really helpful. It has a diary in the back that you can fill in to help you kind of work out what activities are difficult for you. So it's really good to use. There's also the Macmillan support workers based here at BHOC, but also at Western General Hospital. They can be contacted, and also you can contact them to access myself if you had any questions from the presentation. So if this is something that you're struggling with and you feel like you need some more help, you could always consider asking for a referral to your community occupational therapist via your GP. The NHS has some really good apps that you can access for anything from relaxation to advice on how to sleep better, to mindfulness. So there's some websites for that. So basically we've covered what is cancer-related fatigue, tips for managing fatigue, and hopefully given you some ideas and get you started on ways to think about resting more effectively. So if you do have any questions, please do contact the Macmillan teams here at the hospitals. So thank you ever so much for listening.